So what does the South African Medical Association say about all this? Let's bring in Dr Mvuyisi Mzukwa, the chair of SAMA. Good evening to you and welcome, Dr Mzukwa. We appreciate your time. What is SAMA's position tonight on the drop charges against Bongani Lani?
Good evening to you, Iman and Bongiwe, and thanks for having me. The South African Medical Association was really concerned about, the public, not necessarily about, the charges against Matthew. So the South African Medical Association really is concerned with the fact that there's lots of people who are purporting to be healthcare workers who are giving advice at times and also selling some health products, to the public, without really getting approval from SABC and all the other relevant authorities in the country.
But what does the law say on this, especially the law that governs medical practice? Our understanding is that, people aren't just allowed, if they're not registered in respect of any health profession, they aren't allowed to pretend, they can't use a title, a description. They can't basically lead people on that they do have a qualification that they don't, and especially in this arena where it concerns health, the taking of health advice from somebody who would know nothing about it.
Yes, you are quite right, but I think the communities as well, they need to make sure that when they interact with social media, they are dealing with the real healthcare workers or professionals who are registered with the relevant authorities or regulatory bodies in the country. Because if you notice this, it's difficult for communities, to prove on social media, that this person is really registered with the HPCSA or the nursing council and stuff like that, because in most cases they don't really use their actual names on those social media platforms. So it makes it difficult for healthcare for the general public to determine whether this is a proper healthcare worker or not. So it's important that we really remain cautious when it comes to these social media interactions and people giving advice purporting to be healthcare workers. You will recall that this started or it became prominent during the COVID-19 epidemic or pandemic. So at that time, everyone emerged as a healthcare expert, giving advice and dishing out even medicines to the ill. So I do think that we need to be very careful this time around, because it has got serious implications in our lives if we do take that.
Yeah, I'll come back to the responsibility the public has in some ways for making sure that people are properly vetted. But this man styled himself as a doctor. He spelled out on social media how and where he got his apparent qualifications. He appeared in scrubs, posted videos, finally caught sneaking into a public health facility, apparently for content. So to sharpen that question, do you believe as SAMA that he should face charges?
Well, as the South African Medical Association, like I said, we are really in for the protection of the public. If there is anything that is wrong that has been done by this doctor or fake doctor, that he must be brought to book. But if there's no evidence, there's no evidence. But what makes us get worried is if somebody gets into the public health institutions and purport to be a doctor, and even at times take pictures, and that could compromise the privacy of patients. We are really worried about such things. I think if there's any evidence, that is out there, should be used in cases where patients' rights have been violated. We cannot compromise that one.
Yeah, sorry, I just, I really thought, Dr. Mzukwa, that it was clear, because I'm just looking at Section 40 of the Act as cited as has been cited in relation to the case that anyone, who uses a name, a title or description, basically poses as a medical doctor in this case, could face a period not exceeding 5 years or both a fine and such imprisonment. Maybe we'll find another resource to see if that actually still stands in law. But you have raised issues and concerns that if people follow the advice or believe what somebody who's purporting or pretending to be a healthcare professional is saying, that could be dangerous. What is the easiest way for the public to say, okay, I'm following X and X person, this is what they're saying, how do I make sure that they are who they say they are? Just walk us through a process that the public can undertake to vet that person.
I think first of all is to make sure that that person is registered with the HPCSA. If that person purports to be a doctor, or if this person purports to be a nursing practitioner, then the nursing council is the one to go to. But it is important that you go also to the website, HPCSA website, you go to the iRegister and you punch in the name of that person. You know, like I said, man, the difficulty in this case is that most people, when they use social media, they don't use their actual names. They've got their other handles that they use there. So it becomes very difficult for the public. But in any case, they need to verify that if you can't find this person on a register, you must be very suspicious that you might be dealing with a fake practitioner. So it's incumbent upon all of us to do that.
Well, thank you so much for coming on tonight and just sharing that sort of public service warning around ensuring that the people we are going to believe, or more especially take medical advice from, we've got to make sure that they are who they say they are and that their credentials, most importantly, check out. And Dr Mzukwa has given us some resources for how we can do that. Dr Mvuyisi Mzukwa is the chair of the South African Medical Association.